here's the situation. COVID has not disappeared. It's actually going up in many parts of the country. We're seeing an increase of cases because of the BA.5 variant. So now we have an issue. How do we optimize people's immunity? And right now, being fully protected really does mean at least 3 doses. So people who have gotten 2 doses are not going to be adequately protected against COVID. It really is a minimum of 3 doses. And now we have a question of who do we give a 4th dose to? The benefit that you're going to draw from that 4th dose is dependent on a number of factors. How long it's been since your 3rd dose, how old you are, how many pre-existing other risk factors you have, but also what level of risk you have. Are you in a type of job, or do you have a lifestyle where you come into contact with a bunch of different people? Or are you somebody who mostly works from home and doesn't come into contact with that many people? So all of those factors are really going to determine how much benefit and how much need you have from a 4th dose. And that benefit risk, that seesaw of when you need that 4th dose is shifting now because we're seeing more and more COVID. So for the most part, I think most people probably are going to benefit from a 4th dose, especially if they are coming into contact with a large number of people and living in big cities, parts of the country where we're seeing an increase of cases. So overall, I think you're seeing the consensus shift towards most people getting their 4th dose. Had you asked me this question a month ago, I probably would have said, wait until the fall when we have an Omicron-specific vaccine that's updated against the current strains. But the reality of the situation has shifted quite a bit over the course of as little as a month.
So let's talk about this latest wave, the 7th wave of COVID that some say could peak in 2 weeks. We're in a situation now where we're not getting the sort of daily updates we did from public officials. There isn't the same emphasis on case numbers. There isn't the same emphasis on testing. So what do we expect this 7th wave to look like, and how will we even know how big it is and when it peaks?
Well, you've raised the interesting question, is that we probably won't know. We're only going to know this sort of in retrospect. Now, we can draw some inferences from wastewater data, but not every region has access to wastewater, right? Unless you have a sewer system, you can't actually test wastewater. So we might have a sense of what's going on in Toronto, Montreal, some of the other big cities, but not every province is making that data available. So we have to draw inferences. We can look at the test positivity rate on the limited number of tests that are being done and sort of assume that it's representative of the general situation, but you're right, we don't have data. And so part of the thing that's always bothered me about the current narrative of like, well, you judge your own risk, you figure yourself out. Well, how are you expecting people to do that unless you give them the data? Unless you tell people how much COVID is out there, people won't know what their personal risk is. I think what we can say is that their risk is higher now than it was 2 weeks ago. And so if you have to gauge your own risk, well, I would take some very basic precautions, which really amounts to nothing more than just updating your vaccine status and wearing a mask in public, 2 things that are easy to do and frankly cost you really nothing in the grand scheme of things.
Time for one more question. I'm going to let you underline the masking aspect of this, of course. The advice has been to wear masks for so long, and their effectiveness dealt with by officials. But as we know, when you walk the streets, and certainly when you go into stores, you are seeing fewer and fewer people wear masks. How big of a contributor is this to protecting us, and how much emphasis should people put on continuing or putting their masks back on again?
I think you can't underestimate how important masks have been. We had no flu in Canada for 2 years because people were wearing masks and being careful. And then the minute people stopped wearing masks, we had a resurgence of the flu. So, I mean, we're seeing the same thing with COVID. Had you asked me back in 2019, will we ever get rid of the flu in Canada? I would have said, no, it's impossible. The flu is always going to be here. And yet when people wore masks, the flu went away. Masks work. They are a mild inconvenience. It's one more thing you have to remember to bring with you, like your car keys and your phone. But frankly, I don't see why you wouldn't have it with you. I don't see why you wouldn't put it on if you're going to be in an indoor space breathing the same air with a bunch of different people, because you're less likely to get sick. And it costs you virtually nothing, and it has no downside. So I think we have to start rethinking our use of masks in the same way that we eventually rethought our use of bicycle helmets, right? Nobody wore a bicycle helmet 20 years ago. And now I think we've come to understand as society is like, no, this is routine. If you're going to be somewhere, you got to take your bicycle helmet, clip it to your bag, and carry it with you, despite the mild inconvenience it is to have that extra piece of equipment with you at all times.